Assalamualaikum, I'm Dr. Junaid Jangir. I welcome you in another episode of Teaching on Patient series. Today we have a 4-year-old girl and she presented to me with inability to close the one eye. There is excessive salivation and drooling from the left side, and she also complained of excessive tearing from the left eye, and the father told me that she also has facial asymmetry. So considering these complaints, I thought that this is a case of facial nerve palsy. Now I will do the maneuvers of facial nerve examination for all those students who are going to appear in the short case. Keep this thing in mind that the facial nerve is the 7th cranial nerve and its nucleus lies in the pons. Now the maneuvers of facial nerve examination. The facial nerve has motor function, it has sensory function, and it has secretive motor function as well. But usually in exam, the motor function is tested. First of all, I will test the motor function. So, beta, आपने मेरे उंगली को देखना है. So first of all, I'll check the frowning. So in facial nerve palsy, there will be no frowning on the affected side. Beta, आप अपनी आंखें बंद करें. So you can see clearly that she's not able to close the left eye properly. Beta, ab दांत दिखाएं. So when I ask the child to show me the teeth, there's a clear deviation of the mouth towards the right side. So keep this thing in mind that she has facial nerve palsy of the left side, but the deviation of the angle of the mouth is towards the right side. Always keep this thing in mind that the angle of the mouth will be deviated towards the opposite side. बेटा अपने मुंह में फूंक भरें. When she blows, I will tap with my finger on both cheeks. The air will escape from the weak side. So, the left side was weak, so air got escaped from the left side. And now, I will look the nasolabial fold. You can see clearly that the nasolabial fold is flat on the left side. So the nasolabial fold will be flat on the affected side. Now I will do the whistling test. बेटा, जिस तरह मैं सीटी बजाऊंगा, आपने इसे सीटी बजानी है. So you can see clearly that she was not able to whistle properly. Why? Because the air escapes from the paralyzed side. When she tries to whistle, the air escapes from the paralyzed side. Now you all know that the branch of the facial nerve which supplies to the stapedius muscle can also be involved if the lesion is in the facial canal. So in order to check hyperacusis, I will inform the patient first. बेटा मैं दोनों साइडों पे चुटकी बजाऊंगा ऐसे. आपने मुझे बताना है कि क्या एक साइड पे बहुत ज्यादा आवाज तो नहीं आई. She don't have hyperacusis. The secretomotor function of the facial nerve can also be tested because the anterior 2/3 of the tongue is being supplied by the choroidal branch of the facial nerve. So in order to check the secretomotor function, you need to have 4 small bottles, one having some sweet taste, one sour taste, one salt taste, one sour, and the last one is bitter taste. First of all, you explain the patient that I have these 4 bottles. मैं एक-एक कतरा आपकी जुबान पे लगाऊंगा. आपने बताना है कि टेस्ट कैसा है. Like if it is sweet, you need to say 1. If it is salt, you need to say 2. If it is sour, say 3. If it's bitter, say 4. When you apply those tastes, please wipe the tongue first with the gauze piece and please check the bitter at the end. This was all about the steps of examination of facial nerve. Thank you.